Well, Dr. Rob Bello and I go back actually 20 years ago to chiropractic college when we were in school together. So it's good to reconnect with Rob. And he reached out to me about a year ago or so. And I had started using BPC 157 actually to help to heal from a ruptured distal bicep tendon. So I actually tore my bicep tendon in March of 2024 and decided not to get surgery, even though that was recommended, and did a whole bunch of natural things, including things like red light therapy and soft wave TRT. And this is when I was introduced to peptides. Another clinician said, you should use peptides. You should look at BPC 157. And so I started using that. And I credit it with helping improve my recovery process. And then Rob reached out to me and said, "Hey, I'm manufacturing this product," and started this company, BioThrive, and looked at the great stuff that he was doing, and I decided this is the product I want to start using. And I've definitely noticed a difference just in my recovery from exercise, my overall inflammatory load. Give it to my wife as well. Just feel more rejuvenated with it. So really, really great product, and I'm excited about this interview. So, Dr. Rob, let's talk about how you got involved with peptides.
Thank you, Dave. Great to reconnect with you. It's been exciting to be able to reconnect with a lot of old colleagues from school, and really exciting to see what everybody's been doing and going in their different directions, and that we can all reunite and start working together has been great. So, I got introduced to BPC about a decade ago. I've done some competitive powerlifting, and I kind of found out about it from the gym and the gym bros. I'm half gym bro and I'm half clinician. So um, some of the powerlifting teammates of mine introduced me to it, and my when I saw the results and used it myself, my clinician brain just exploded. I couldn't believe that what a turnaround in such a short amount of time, where I had been doing, my chiropractic practice has evolved as my performance requirements have evolved as well. I started as an upper cervical doctor. I still do upper cervical. Then I realized that, as an athlete, I needed different types of treatments. So I started getting into more soft tissue treatments, and um, ART and Graston and dry needling and all these things have really helped me out. And the peptides were something that were were like nothing else. So that was really exciting for me. But at the same time, as a clinician, at that point, they were only available injectable. And as a chiropractor, it's not in my scope of practice. I don't have the medical side to the business. So it really wasn't an option for me. I couldn't really recommend it to people. I couldn't, promote it. So I sort of, spoke about it to friends in small circles, but couldn't use it clinically. And then I had a friend from chiropractic school, another friend, who was telling me about the results he was getting with an oral product. And, as my, having that gym bro side to me, I was like, well, it's got to be the injectable's got to be better, right? The oral, I inject into the site, and all of the same misconceptions that I deal with on a daily basis, answering questions. I couldn't wrap my head around an oral being as effective until we tried it, and it was impressive. It was as, if not better, because at that point we're ordering from websites, and the quality is a little dubious at times. And one time you get a good product, and another time you don't. And now seeing behind the curtain, I know all the reasons for that. And this was just lock solid. We had a great raw product source, and it was a clinician owned company, so everything that they did from start to finish was focused on patient outcomes and patient safety. And that's where I sort of cut my teeth, and we've really continued that edict in our practices, that this is there. In the peptide world, peptides are so hot right now. I mean, just from this conversation, I'm going to have, 5 to 10 promos on my social media about BPC. And a lot of those companies are marketing companies, they're profit-centered companies. We're a clinician-owned, operated, and curated product for a optimal patient experience for all sorts of variations of patients that we see in the office. There are autoimmune patients, very sensitive patients that can't tolerate
Mhm.
any nonsense. So products have to be clean, they have to be potent. And those are our main focuses, and since we focus on that, it's actually been sort of um, a differentiator for us because people try our product and they've tried another product and like, wow, yours really is working very differently. And it's really because we have the amount of product in the actual pill that and we've actually contracted with a manufacturer to have, 10 to 20% more product in the pill. So these are potent, very clean products, and it's been quite a roller coaster. Once we got the ability to promote with the oral version, it's just it's really lit a fire underneath me. I went from distributing another product to then being out there and getting all the pieces together uh, to produce my own product and have a hand in the start to finish. And it's been growing every day. So it's been a real blessing for me, my patients, my family, my colleagues. So yeah,
Yeah.
that's kind of the origin story.
Yeah, that's great, Rob. And let's talk about BPC 157, Body Protective Compound 157. It's one of the most commonly used peptides in the peptide world. There's so many different types of peptides. Let's talk about BPC 157, basically what it is and all the different benefits it has.
Absolutely. So yeah, we call it and that's from a Dr. Seeds. Dr. Seeds is a big peptide expert, and he's spoken to the Croatians that created BPC 30 years ago, and he was quoting the chemist that created it, and he said this is the king of the peptides, and truly in our experience, it really is. It's just so ubiquitous. It's so easy to, so many people can benefit from it. Especially people, chiropractors or other practitioners that have patients that are coming in generally in pain. And there's a level of inflammation. I tell people, do your patients have acute inflammation? Do they have chronic inflammation? Well, yes. Well, then more likely than not, they can be um, uh, recommended BPC. And in general, I think that's probably one of the biggest effects that we get from BPC is that they are systemic anti-inflammatory. And that we know inflammation is behind so many different pathological and deleterious processes that if we can reduce the systemic inflammatory load, we can help out so many things. I mean, I usually am talking about the gut issues, the ligament, tendon, soft tissue healing. But we've seen so many different things respond because inflammation is behind it, at least a partial cause of it.
Mhm.
So we've heard anything and everything under the sun respond. So BPC stands for body protection compound. It is a a bioidentical molecule that is naturally made in our gut, and it's produced in our gut to help heal the gut from the acid environment, um, all of the stuff we put in our system with your standard American diet, and it is a potent anti-inflammatory. It also, peptides are intelligent. They get called over to the site of injury through a process called chemotaxis, where then they are signaling molecules and they signal to the end cells and tissues to basically to work better, to process that. So when we use the word anti-inflammatory, some people say, well, ibuprofen or NSAIDs, those are anti-inflammatories. Well, these work very differently because inflammation, as we know, is a part of the healing process and is very important for soft tissue remodeling. So when you take something like an ibuprofen or an NSAID, that chemically stops the entire inflammatory process, which can give you some symptomatic comfort, reduce the discomfort in the short term, but it also is blocking the beneficial inflammation that we need for this soft tissue remodeling. So the BPC will signal to the cells to allow the cells to allow the good inflammation to come in and then get rid of the excess chronic inflammation. So it's very different when you're just using the word anti-inflammatory. They also then, when they're called over to the site of injury, are responsible for stimulating angiogenesis. All right, angiogenesis is the formation of new blood vessels at the site of injury. Also, BPC will stimulate fibroblasts to create more collagen 1 type fibers. Again, so you're talking about anti-inflammatory, reduction of inflammation, increased blood vessel production, and collagen synthesis, all a perfect situation for soft tissue healing, for bone healing. So it's a real powerhouse.
Hmm.
And it's something that's very tolerable and is very bioactive. The body, as being a bioidentical to something that is made in the body really recognizes it and uses it readily. So it's yeah, it's something that we see people do very well with.
Hmm. Is it something that we make more of when we're younger, BPC 157, just naturally, endogenously? We make more, and then as we get older, we produce less. I know children heal so much quicker, and there's probably a number of different mechanisms, but my sons are basketball players, and one of my sons, he hurt his hand, his wrist, and we thought he might miss a game, right? And I said, no, no, no. I said, that injury would probably take me 2 weeks to heal from, and he'll heal in 2 days. And he did,
That's
and he was
that
fine.
that's exactly right. And as we know, that's the same with so many helpful recovery molecules that we do make endogenously, like growth hormone,
Hmm.
testosterone. These are things that when we're younger, we're making a lot more of, and the same with BPC. And we get older, we make less of it. And one of the things that BPC does that a lot of people don't recognize, and it points to your benefit you were talking about that you've been experiencing when you're getting less
Yeah.
sore, right? Because BPC, it actually increases your growth hormone system efficiency.
Mm.
It doesn't give you more growth hormone. It actually just upregulates your growth hormone receptor. So when we're living a chronically stressed life and maybe we're not doing all the things nutritionally, that's perfect. Our body sometimes will then downregulate those growth hormone receptors, and we don't use our natural growth hormone as well. So I tell people growth hormone is like having 20 boats floating around in your blood, but you only have two docks. Well, now you take the BPC that gives you 10 docks, right? And so now you're utilizing your own growth hormone. So we're getting, one of our biggest demographics are the lifelong active patient that's in their 40s, 50s, and 60s. And, we see it all the time. I'm not recovering like I used to. I used to be able to play, you know, 3 rounds of golf, no problem, and, do it again in a day or two. And they're just not able to do that anymore. And now, often they'll start the BPC with an injury. Say they have a little shoulder tendonitis. The tendonitis starts to feel better, and then they realize, hey doc, is this something? Can I keep on taking this? Because honestly, like my whole body feels better. They're describing. It sounds like they're taking an exogenous growth hormone because they're actually just feeling the effects of utilizing their own growth hormone well again, and they haven't done it in years, and they're recovering like they did 10 and 15 years ago. And BPC is tolerable longer term. I always tell people, listen, you want to take a break here and there and let your body, recalibrate, but with oral interventions. We're always thinking about, is there a liver, is there a kidney toxicity? And I mean, actually, BPC is is hepatoprotective, is nephroprotective, neuroprotective. It definitely is much more. When we start to talk about the TB-4, which I'm sure we will, that's something we do recommend, 3 months at a time, then take, a 4 to 6 week break. But the BPC is something that people will start more, and I work with a lot of orthopedic surgeons, nurse practitioners that are a little bit more medically minded, and just like you were talking about before with the layering of the regenerative approaches, where we've found that that's actually an amazing protocol, and we've partnered with a great stem cell company called Jevity, and they've been utilizing uh, our BPC before and after a lot of their biologic
Mm.
applications, and seeing outcomes just explode. I have orthopedic surgeons that are private labeling now. They're doing the BPC or the Wolverine pre and post PRP, as well. Where we're working with Softwave distributors, and the same thing. When they knew, they've done their thing for so long, they knew that, they were getting 60, 70%, patient success. And with the BPC, now they're seeing 80. So now a lot of these practices are utilizing it. Don't even offer PRP unless they're going to do BPC with it. Why take the chance of having a 50-50 result when you can have a 75, 80% positive result on a regular basis?
Yeah. So these regenerative medicine clinics, basically, that people are going to get a lot of these therapies, platelet-rich plasma, stem cell therapies, things like that. People that, for example, there's a lot of individuals that have degenerative joints, right, where they've, lost the disc space in their spine or in their knees. Instead of getting a hip replacement, they're saying, hey, I want to go out and see what I can do from a regenerative medicine approach than rather just getting a bolt, stuck in my hip, right, for the rest of my life, which has,
100%.
for a lot of people, doesn't actually even really give them much benefit. And so they're going out, they're doing these therapies, and they're finding that utilizing the BPC 157 with them gives them much higher success rates
100%. Yeah.
at healing and recovering from these kinds of long-term chronic degenerative conditions. So real powerful stuff. Now, what is kind of the clinical dosage that people should be looking at with a BPC 157? And I also want to talk about difference between, you mentioned this earlier, but there's a lot of these kind of anti-aging peptide clinics that use BPC 157 injections, right?
Mhm.
And they have some benefits as well, obviously. And then let's also go back and forth between like pros and cons of BPC getting it done through injections and also through taking it orally.
Sure. So that's probably the biggest question we're asked, because in the dialogue, it's dogma that's kind of been stuck there for years, that the oral is good for stomach issues and the injectable is better for your joint issues. And I always tell people that was the case, right? That was true at a point in time. Um, BPC has been around for 30 years, and it was doing so well that clinicians were saying that, well, we have a limited amount of people that are willing to inject themselves once, if sometimes not twice a day. Peptides have short half-lives, so really ideally should be dosed twice a day to increase the healing window. So what they did was they took the same ester, the BPC 157 acetate, which is what's in the injectable. They put that into a pill form, and they found out that it helped out with stomach issues, but it didn't help anything else out, because BPC 157 acetate is about 3% bioavailable when taken orally. So now that's been forever in the dialogue. And that is about 5 or 6 years ago. Chemists were working on a better orally available formula, and they came across BPC 157 arginate. The arginate form is 90 to 98% bioavailable when taken orally. I've on our website, I've included a lot of peer-reviewed papers that talk about different conditions that the BPC is seen do very well with. But we've also, because this is such a common question, that we've added some papers that speak on the oral versus injectable controversy and issue. And we've actually also included the arginate patent papers, which show if you have some time and you're willing to go through some pretty dry material, it's there where they show the charts and they show the two head to head in a high and low pH environment, in a high and low temperature environment. And we see the BPC-157 arginate just not budging, 98, 99% bioavailable. There's actually a chart where they show both compounds in a 120 degree Fahrenheit environment for 90 days, and the BPC arginate is still 90% bioavailable after that. So people see, sometimes when we ship to people, they say, well, shouldn't this be refrigerated? And that is all true with the
Yeah.
injectable.
Okay.
When you reconstitute it, when you have a reconstituted peptide, it's got to go right in the fridge, right? You can't shake it up. It's very unstable. The arginate molecule is very different. It's very heat resistant. The product is, I think it's about 2 years from manufacturing, that the expiration date is. So it's a very different compound. So
Yeah,
then, well, then,
interesting. So
and
the
then, and
acetate, it's like a binding amino acid on the
it,
BPC 157
It's
or
it's the salt group. It's
and the
the salt
arginine.
group.
Okay, the salt
Yeah.
group. Yep, to
Yes.
help carry it in and it gives it
Correct.
more stability.
Exactly. Exactly. So, um, yes. So but as far as the dosing you asked about, so we generally dose 2 pills a day, which is about 1,000 micrograms or
Mm.
a milligram, which then which is more than uh, what the injectable is, because the injectable is 100% bioavailable. So we're making up for anything that's going to be lost in the digestive process. And basically, what I'll tell people is that two a day, one in the morning, one in the evening, generally on an empty stomach, at least 30 to 40 minutes before or after food. And it has to be just at least 3 to 4 hours apart from one another to really increase that healing window. So that generally some people will experience a GI issue from it. If there's any stomach issues that are last for 3 or 4 days or longer or are more intense, if you take it with food, that pretty much kills those
Mm.
issues. That's and it really doesn't change the efficacy. I've seen so many people go from uh, taking it and they were having stomach issues, but their other issues were feeling better. They started taking it with food, and their pain issues still got better, but their stomach issues pretty much went away.
Yeah, it's a good general recommendation for people that struggle to take supplements away from meals. Zinc,
Mhm.
for example. A lot of people
Sure.
they try to take zinc and they get nauseous, right?
Yeah.
It's a classic one. And so yeah, if that's you, if you got a more sensitive stomach, definitely take it with food and you'll get better benefits. And BPC 157 really helps close the intestinal lining. So,
Sure.
in our society, when we talk about autoimmune conditions, chronic
Sure.
inflammatory conditions, non-injury based inflammatory conditions, we have to look at gut permeability, intestinal permeability, because when that intestine is damaged, large undigested proteins, bacterial proteins, and toxins from the bacteria and the different microbes in our gut will get into the bloodstream, send the alarm, signal the alarm
Yep.
system in our body, and drive up inflammation. And so we know with autoimmune conditions, chronic inflammatory conditions, we've got an issue with intestinal permeability. And BPC 157 is one of the best things for healing that intestinal permeability and creating strength and integrity to the gut lining.
100%. And that actually leads me to an interesting topic where we had was my third party lab. So we get everything third party tested for everything possible. When people say they get third party tested, it's usually for purity and identification, and
Yep.
that's kind of standard. We use an FDA certified contract manufacturer. They won't touch the product unless we have that, right? And then we get once they've created the pills, they send it off to a lab to get it third party tested for
Hmm.
quantification or for potency to make sure what's in the pill matches what's on the label. And
Yep.
again, that's where a lot of issues come into general orals is they don't do that quantifications. And our lab will tell us that they see products sent all the time. Some product has no active compound in it. Others have 100 micrograms in one pill, 300 in the other. So it's really all over the place. But our lab, we ask to have endotoxins, right? Because a natural byproduct of peptide production
Mm.
is something called LPS. And I know Dave's familiar with that. It's called lipopolysaccharides. And we were talking about that this weekend
Yeah, it's
in
a
my,
potent inflammatory trigger. In fact, when they want to create an inflammatory condition inside of, test mice or rats, they'll actually inject LPS directly in to create a sepsis-like response in the body.
yeah, so my lab told me, said, well, you're doing the oral, right? I said, yes. And said, well, you don't even have to do save yourself the money. Don't do the endotoxin screens because most of that'll just get eaten up in the digestive process. And I was like, no,
Yeah.
no, no, no. I mean, we were literally learning about this weekend, one of my continuing education and courses, just like you said, when you have those gap junctions that are now permeable, things like LPS will get through. And especially,
Hmm.
maybe for the larger population, that won't be a problem. But we deal with a very sensitive community. We have a lot of autoimmune patients coming in. My stem cell company does a lot of IV infusions specifically with autoimmune patients. So we can't tolerate any of that. So we have all of those endotoxin labs done as well, just to make sure that everything is as clean as possible.
Yeah, great, great. So that's a big differentiating factor. And
100%.
so let's talk about TB4 Frag. So TB4 Frag is another common peptide that's out there. It's something that you've worked a lot with. Let's talk about the benefits of this.
Course. Um, TB-4 Frag is another peptide that's made by the body. It's made in the thymus gland. As we know, the thymus gland is a vestigial gland that atrophies by the time we're in our late 20s or 30s, and it serves as an immune organ or gland, that is. And the molecule that the thymus gland makes is called thymosin beta 4. Some people use it interchangeably with TB-500. It's not exactly, but we don't need to get into the, splitting of hairs with that. TB-500 is the injectable peptide that is commonly used, and it's mostly known for being paired with the BPC because the two have very similar qualities, but also are very synergistic. And it's not just synergistic; it's kind of exponential. It's 1 + 1 = 4, right? Um, so the TB-500 is as well a potent anti-inflammatory. So when we stack the two together, you have double the anti-inflammatory effect. The TB-500 also is angiogenic, so you're getting even more blood vessel production. Where the BPC helps to stimulate more collagen 1 type fibers in the fibroblasts. Well, those fibroblasts have to migrate over to the site of injury, and often about 70% of them will die off before they get there. So the TB-500 stimulates increased cell migration. So now we have all these collagen producing cells over to the site of injury, even at a higher degree. TB-500 are, we'll get into the difference between TB4 Frag and TB-500, but TB-500 also is an antifibrotic, which helps to reduce adhesion formation, which is huge when you're talking about post-injury recovery, right? Especially a lot of my surgeons are using it post-surgical the stack that is, because if you have like a rotator cuff repair, right? You're immobilized for at least 6 weeks. So during that immobilization, you have all the scar tissue formation to heal, but you're getting all this unwanted adhesion. So usually the first step after the immobilization is you go to therapy and they take you through passive range of motion to break up all these adhesions. So the TB500 allows much less adhesion formation. And when that happens, often our patients are going in, the therapists are taking them through passive range of motion and are blown away by how far ahead of the game they are. Not to mention as well, a lot of these guys are out of pain in less than a week. I mean, I can tell you, ruptured Achilles tendon repair, rotator cuff repair. These are all within the last month that we've seen that are reporting back within 3, 4, 5 days, pretty much out of pain, didn't have to use any of the strong pain medication. So yeah, so that becomes a real big factor in how we recommend, is BPC, stack, or and then so the difference between the TB500, so the TB500 in its normal size molecule is too large to be orally bioavailable. So what they have to do is they take a segment, or in our case, two segments that are smaller. So we have a TB4 Frag, that's the 1 through 4 segment, and then we have the TB4 Frag, that's the 17 through 23 segments. Now, these are the most bioactive strands of the TB500 molecule that also have the least amount of side effects. So basically, with those two, a lot of the products that you'll see have the TB4 Frag 1 through 4, and that is great. It has all of those benefits. It also has some cardiac benefit. The TB500 is also an anti-apoptotic, right? So that's cell death. So when you have a tissue like cardiac tissue, when those cells die, they don't they don't make new cells, right? They create fibrotic tissue. So there have been studies, they were looking at possibly using large dose of TB500 in cases where people were having a myocardial infarction to help reduce the cell death and the fibrosis that will happen in that acute situation.
Yeah. So when you're
Uh,
talking about fibrosis, you're talking about basically like scar tissue. So we think
correct.
about scar tissue, it's not as pliable, it's not as functionable, right, as normal
Right.
tissue. It's kind of just taking up space. And in the short-term process of the healing, part process, there can be benefits to having some scar tissue, but ultimately we want to replace that with beneficial,
Sure.
functional, stress-resilient tissue. In particular, in our arterial lining, in our heart, things like that, very important.
Yep, exactly. So then those TB4 frag molecules are what enable that TB500 compound to be bioavailable, uh, taken in an oral form.
Yeah. Yeah. Great. And now also taking the TB4 frag with the BPC-157, I know there's something called the Wolverine Stack, right?
Correct.
Which combines those. Can you explain that and the synergy there?
Correct. Yeah. And just kind of, I was kind of touching on that before, where they're both potent anti-inflammatory, so you're getting double the anti-inflammatory effect. They're both angiogenic, so you're getting even more blood vessel production when you're taking the two together. When you take the two together, the BPC will help to promote the collagen 1 type fiber production, and then the TB4 will help to migrate, or to increase cell migration to the site of injury. So you have more of those healthy active cells repairing that injury. And really, that stack has been, I mean, the BPC has got the name recognition right now, but at this point, people, once they try the stack, it's been probably as much, if not even a better seller, than, because people are just feeling that real, and talking about as far as the reduction of soreness or increased recovery post workout. I mean, people are feeling better than they have in such a long time. And even with, when we talk about the BPC increasing the growth hormone efficiency, right? Because we know that the BPC upregulates growth hormone receptors. Well, we know that growth hormone upregulates androgen receptors, so that's what utilizes your testosterone.
Mm.
So I even tell people, this is the case if you're not taking anything exogenous. You're just allowed to, you're enabled to use your own more naturally. But if people are doing other interventions like TRT, and if their androgen receptors are downregulated, they're not even utilizing what they're putting in their body. Right? That's one of the reasons they may not be having the effects that were intended. So BPC can kind of be a link to helping make so then not only are you utilizing all of it more efficiently, but then you may not, even if you are using an exogenous source, you may not need to use as much because you're actually just utilizing a small amount and getting a much bigger effect.
Yeah, that's a really important thing for people to recognize in general. Even when you're looking at lab testing, somebody might have, for example, really high B12, okay,
Hmm.
but they're not actually getting the B12. They're not actually absorbing it and getting it. So their serum B12 may be high, but they're not getting it intracellularly. Or high thyroid hormone, but not getting it, or normal thyroid hormone, but not getting it intracellularly. We see that with insulin resistance. It can also be the case with testosterone. You could have high testosterone because either your body's producing it or you're taking TRT, but it doesn't mean that testosterone is actually having the desired effect in your
Right.
system. So this is
Right.
important. So good receptor sensitivity and receptor activity is really critical. And so you're saying that this
Absolutely.
Wolverine stack really helps with that receptor sensitivity. So you're uptaking more of it. And they call it the Wolverine stack because it's named after the X-Men character. Some people may be familiar with this guy,
Yeah.
but his superpower was his ability to heal like rapidly.
Correct.
So he would
Yeah.
get hurt and he would heal just rapidly, like significantly faster than a human would heal. And so obviously, ever since that cartoon character came out, that superhero came
Yeah.
out, people are like, I want that superpower, right? And
Yeah,
so,
it's kind of funny. It's kind of quirky. It's
yeah.
cute, but I can tell you that I've seen people that have been struggling, and sometimes a lot of people think, well, this is only for acute issues. I've seen people that have had things that were 3 years old that have a really significant response, and with those, listen. We don't give anybody any guarantees with anything. Just like any intervention, everybody's going to respond differently. I can say we see pretty regularly about 75% of people have a positive response. And does that mean that things are 100% better? No. I mean, often we have somebody that'll have something that was an 8 out of 10 and now it's a 2 out of 10 and their quality of life is completely different. They're very happy. So that is that's a great thing. And with the Wolverine, I've seen too, like, some people will start with the BPC and maybe it's not doing the trick, and then, we'll move to the Wolverine and it'll just be a game changer.
Now, is there a time where you will recommend the BPC-157 as opposed to the combination with the TB-4 Frag?
Yeah, there definitely is a couple, like with the Wolverine generally, I tell people if you have a bigger issue and you want a quicker turnaround time, go with the Wolverine. And it's not, it's sometimes it's going with the Wolverine for 1 month and then transitioning to the BPC. I have generally I tell people the BPC you want to give it 2 weeks, but we're often seeing people within a week start to feel some effects of it. The Wolverine, I mean, pretty regularly, 4 to 7 days, people are feeling a pretty strong response. Um, I will say that, yeah, so if somebody has, hey, I have a competition, I deal with a lot of competitive athletes. I have a competition coming in a month, or someone that's just like, hey, I have a vacation coming in a month. I need to be able to be active. Start with the Wolverine. And generally, what we do is we start them with the Wolverine. And towards the end of the month, I tell them, listen, let's reassess. You either self reassess if you're not in my office, or you can reach out to me. We can talk about how you're progressing. If things are generally doing much better, then maybe we will move to the BPC. Or or if you feel like you're just kind of getting going, maybe we'll do a second month of the Wolverine. And then obviously there's I try to meet people with where they're at, right? So if there is a financial issue and it's like, listen, the Wolverine, first of all, people look at peptides and they see the price point, and I try to explain to them this is not multivitamins. This is more in a regenerative medicine space where, we're comparing it often to PRP and other interventions that are, in the thousands of dollars. So, but when they try it, then they get it. So often somebody will say, hey, listen, let me just be conservative. I'll start with the BPC, sure. And they start to see, oh, wow, this is different. And right away, it's value perception changes, and they're like, second month, I'm definitely doing the Wolverine. But as well, I also tell people, do I have to be on this forever? I hear that all the time. I tell people you can guide your own journey with this. Some people are just problem, focus. Something hurts, they start taking it. 2 weeks later, it stops hurting, they stop taking it. And that's fine if that's the way, and then they have a half a bottle if something flares up. Often, I'll kind of guide people through that as well. If they've been doing it for a couple months and maybe they moved down to they're doing one pill a day just to keep the systemic inflammation down on more of a maintenance level, and then something flares up, well, you can bump up to, 3 pills a day for, 3 days, 3 or 4 days, just to kind of get it. And that's the thing, just like any other intervention like chiropractic, the sooner you get to it, the better it's going to be. So if you have it on hand and you can address it right away, often it'll be a much shorter issue.
Mm.
So
Yeah.
and then after the 3 or 4 days, you can come back to two a day, and sort of, but you can sort of play with it like that. These are very safe. We're not even close to any sort of, the toxic doses are through the roof. I mean, I've seen and heard people taking, equivalent to a bottle at a time. I mean,
Wow.
there's a lot of room there. So it's not that we're recommending these doses because it's going to be toxic at some higher dose. It's just I like to get people to take the minimally effective dose, right?
Yeah.
So a lot of times more is not better, right?
Yeah. Yeah, typically with supplements, nutrients, different things like that, peptides, there's a law of diminishing returns, right? You take a
Sure.
certain amount and your return on investment is not as on par. So you're trying to give, hey, this is the dosage it's going to should give you the best return on investment.
Correct. Exactly. Yeah, because then I hear people literally, oh wow, this is really getting expensive. Like, well, you're taking 8 pills a day. I mean,
Yeah.
I would not recommend that, because if you actually went to 2 or maybe went to 3 pills a day, you actually may see a very similar result because of the law of diminishing returns.
Yeah, absolutely. And so the website is biothrive.us. You guys can check that out. I also sell it on my store. I take it personally. I give it to my wife as well. We both love the products. So they're really good. And we really like BioThrive. And you guys are obviously have really high standards with how you do these peptides. People can go out on Amazon.com, just like any supplement, and they can
Right.
find stuff. But you always want to look for something professional grade made by clinicians for a
Sure.
number of reasons. You talked about obviously testing for purity, but also efficacy, making sure that what it says on the dose is in the dose. And they've done different consumer groups have looked at a number of different supplements that are just kind of sold blanket on Amazon.com and found that the ranges are all over the board, that there's toxicity in them.
Oh,
And so
sure.
this is something that you guys really try to make sure. Can you talk a little bit more about your standards that you have it with
Oh,
BioThrive?
Oh, 100%. So yeah, I mean, it's the old adage, you get what you pay for, right? I see the price point in some of these products that people come to me with, and I don't even have to do the research. I know the pricing of the raw material, and my feedback from my third party labs, and there's no way that there's even, uh, you know, there's no way there's the amount of product in there that it actually says. So again, the potency, the quantity of active compound is one of the big issues. And then when you're talking about product that's coming from overseas, as far as the contaminants, LPS is one, but we're also looking at heavy metals. So these, you have to be careful. I had a point where we were switching manufacturers and we had a gap, and I warned people, don't just try to buy something online. If you do want to buy something, maybe let me know. I can point you in a direction of another preferred provider. And I had one person said that they just had no effect, and then the other person thought they got sick from it. So there's a lot out there, and then as well that gets into what we actually have in the pill. Like we started using some of the industry wide fillers, right? It's these industry standards. And after the first couple of batches, we were having a little bit more stomach issues than I would have liked. So we actually took everything out, and all we have in it now is the active compound and MCC, which is microcrystalline cellulose, and that is just a plant-based, fiber, more or less, and very benign. And we saw, I mean, things that were supposed to not have any an antigenic effect, that once we took out. I mean, I had people that had stomach issues. They took our second version of it, and stomach issues went away. So, and the downside, our manufacturers like, well, because it's very light and fluffy, there's going to be a little space in the pill. I can deal with a little space in the pill rather than someone having, stomach issues and not wanting
Hmm.
to take the product. So really, we source all of the raw material from U.S. Compounding facilities. Our compound manufacturer that takes the product, makes it into the pills, puts it into the bottle, is FDA certified. They have very strict regulations. And we're really happy with the product. Like I said, before we scaled it, we had it for our patients, our friends and family, some of our very familiar colleagues with their patients, and we took the feedback and changed things. And now the product that we have, we are very happy to see the results. Very little side effects. I mean, like I said, some people with the BPC will get a little bit of stomach issue. That's pretty typical, but we want those percentages to be much smaller, which they really are. And then having a strategy to communicate that if they take it with food, they will really have much less, almost no GI issues with that. So we've really kind of, it's not a very difficult process, but getting all of those small little nuance factors right does make a big difference with a lot of people's
Yeah.
reactions.
Yeah, for sure. Well, Rob, thanks so much. This has been a great masterclass on these peptides, and company again is BioThrive. BioThrive.us is the website. So definitely check that out, guys. You can also find it again on Dr. Jockers' store. Just look for peptides, BPC-157, TB-4 Frag, and you'll find that as well. Rob, thanks for all the great work that you're doing. Be blessed, my friend.
All right, my friend. Thank